So, good evening, everyone. Welcome to my IVF Fences and the European Fertility Society. We are back with one more topic today. It's a Monday. We usually have webinars on Tuesday, but this is an exception. But anyways, we are still here to educate you. So as you can see, Dr. Héctor Izquierdo is with us already. Hello, Dr. Héctor. Welcome back. You've been with us before. So we had a few webinars together. So I'm glad you are back here. I hope that you are having a good day. I know it's been long, but I still hope that it's been a good day and you are ready to educate us and of course are ready to simply answer some of the questions as well.
Thank you for the invitation. I'm always happy to be here to educate patients and to share information because, as you know, all this fertility journey is full of questions, full of endeavors, full of very complicated moments. So, a bit of light through information is always very important. So, I thank you very much for the invitation. And I'm happy to be here. Long days, always get over as well. And it's a good thing to do at this time of the day. So, very happy
Definitely.
to be there.
Happy to have you for sure. Just let me mention that Dr. Izquierdo is a fertility specialist and a gynecologist at Clínica Tambre in Madrid. And today we will talk about male infertility. We will talk about what tests you should be you should do, what other tests you might be also thinking about. There are some other extended testing that might be required as well. So of course, Dr. Izquierdo is definitely a person who will be happy to simply advice on that as well. But of course, first of all, we will start with his presentation so he can give you some tips already. But afterwards, as always, there will be time for your questions. And again, let me just remind everyone, it's all anonymous. So don't hesitate. We are here for you. Anything that you would like to ask, I'm sure Dr. Izquierdo will be able to help you out with. So thank you so much, everyone. I see that there are people from Ireland, UK. I'm sure there are other places that you are connecting from. So thank you so much for joining. And now I think we can go ahead with our presentation. Okay, friends as well, great to see you here. Thank you so much. And let's go ahead with the presentation.
So, welcome everybody and good evening. The first thing that I always want to do is to introduce myself a little bit shortly. So, the ones you don't know me, you can get to know me better. My name is Héctor Izquierdo. I'm a gynecologist, a fertility specialist. I specialize mostly in repeated implantation failure, repeated abortion, and immunological disorders of the pregnancy that might stop embryos from getting attached to the womb. But one of my very, very appreciated topics is also male infertility because I believe it's a forgotten topic in the fertility consultation. As the Caroline said before, I'm a fertility specialist. I am one of the medical directors of Clínica Tambre, together with Aura Garcia de Miguel. And the topic we're going to speak about today is the diagnostic, the evaluation, and the management of the male infertility, which is a very important topic to speak about. As you know, male infertility is caused from one from every three infertility issues for families, and it's sadly one topic that's from very late diagnosis because most of the times it's less accessible for men to get fertility assessment than for women to get fertility assessment. As you know, women go regularly to gynecologists, midwives, do pap smear controls so that they are a bit more aware and in touch with their fertility and their health. Men don't really go to andrologists or urologists on a regular basis. As a matter of fact, they start going to them very early, very late. So most of the times, people are not aware that this might be an issue, and that late diagnosis may more complicated the treatment of those issues. Um, Male factor is the truth, and we shouldn't forget about that. It's very important, and it's a recommendation from my side. If you go to a clinic where it's not spoken about the man, where there are no basic diagnostic from the male factor, if there are not going to be any questions asked to men, you are not in the right place because 50% of the fertility issues can be on the men as well. So it's very important to get a basic diagnosis also in the male factor. What is a basic diagnosis? Basic diagnosis is semen analysis, karyotype, hormone test if needed, and examination of the male genitalia just to be sure that everything is working properly. as much as a good anamnesis, a good questions about the past of the patient, ejaculation, volume, and all those things are very important to be asked. How does it work? As you know, most of the good clinics in fertility offer both assessment for men and women. So if you go to a gynecologist specialist in fertility, for example, myself, I am also an andrologist, been educated in men fertility as well. So once you go to the appointment, the first thing you need to do is to ask all those questions regarding the previous history, if there are any factors that are important. For example, did the testicles take too long to come down? Was it any surgery needed? Was there any operation in the genitalia? Things that sometimes get undiscovered. Are there any pain on the testicles? Do you see any balls, any bulbs, any structures that you don't know if they are there? In cases like in some clinics like you can go directly to your andrologist who is also a gynecologist, or some other clinics offer an urologist assessment as well as part of the diagnostic. In Clínica Tambre, as we are so aware that male factor is also a factor, we divided our embryology laboratory into two. We have an embryology laboratory and we have the IVF or egg laboratory. And the embryology laboratory is busy the whole day taking care of those male factors. We at Clínica Tambre have the oldest sperm bank in Spain. That's why we are very, very experienced in treating sperm as a factor in the fertility. Where it's also very important that the patients know as well and are empowered about the information so they know if there's an issue, what's the issue, how to deal with that, or what we found in that. Andrology lab. What is in the andrology lab? So andrology lab is the way we call the place where we process, collect, assess, study, and treat sperms to be used in fertility. The assessment techniques, so the first one of them is seminogram. Seminogram is an observatory technique that allows us to see three major factors: concentration, how many sperms we have in a milliliter of sample; total volume, which is concentration times the volume of the sperm; the second thing is motility, how much of those sperms that we had in the sample are capable of moving, and the motility is divided into different branches. So active motility, which means sperms that move properly and in the right direction; motility, like those sperms that can move but they don't really move in a good direction; and reduced motility and non-motility. And that is a total percentage that should be about 42%, 52% the minimum. And the third factor that's going to be assessed in the sperm analysis is how many of those sperms look normal. So these normal forms. And this is something that always scares the patient a lot because they say, why is so that a so low percentage of my sperms is normal from structure here? That is because male factor, because sperm production is not as adequate and structured as the egg production. So women produce a lot of sperms the whole time, and in that very much production of sperms, failures can happen. A normal sperm is that one that has more than 4% polynomial sperms. What I always say in the consultation is, do not worry. Women are chocolate fabric. We produce a lot of chocolate, some of them better, some of them worse, but women produce diamonds. So they are there, they are not there, and they are very precious. Sperms, they can vary a lot. The samples are not always the same. There are a lot of factors that can influence the sample. So it's different history here. There's also other things that we can study in the sperm in the andrology laboratory. And one of this is the most important for us because it's a very modern assessment, was proven to have a big impact in the number of blastocysts that we can produce, and somehow the number of euploid embryos that we can produce. As you all know, those sperms carry DNA. And if you have compared a picture of a sperm together with an egg, you will realize that the sperm is much smaller than the egg. They carry about the same DNA material. That means that in order to fit all that sperm DNA material in that tiny place, the DNA in the sperm has to be rolled a lot so it can be squeezed in there. As you know, if you roll and squeeze something a lot, it might break. So a certain fragmentation, broken DNA in the sperm is normal. But if it starts to be that much, then it turns very complicated for the egg to take DNA of the sperm, puzzle it back together, and start the first division and production of an embryo. That's why assessment of the DNA fragmentation test is very important because it might allow us to choose a better technique to choose those not DNA fragmented or lower rate of DNA fragmentation sperms to fertilize those eggs with better results. And the rest of the things that are in the apple is also which techniques we have available to select DNA fragmented test. And depending on the situation, if it's a fresh sample, a frozen sample, if it's DNA fragmentation from double strain or from single strain, you might have one or the other technique as the most efficient for you. Other thing that is important is we provide a semen bank, which means that we are responsible for treating those sperms correctly after the law of fertility in Spain, which means that we need to be aware that every sperm frozen it's as validated serology that there are no infectious, contagious risk in that sample. And if so, then to treat them properly before we freeze them, which means to wash all this the serum and all the bad things that could be around the sperms to be sure that this healthy and it is safe to be used to fertility purposes. And the last thing that we do in the andrology laboratory is, as you know, some of clinics offer, and we do as well, the possibility of testing the male for curable diseases that they don't know if they suffer. Then if a patient needs a sperm sample, either because the couple doesn't have a sperm quality that can be used in the treatment, because it's been a repeated implantation failure or other issues there, or because it's a couple of women or a single woman that needs a sperm donor, then in order to match those different factors to be sure that we are not going to produce a baby with a genetic condition that can be avoided. How is the spermogram? As I said before, with general aspect evaluation, color, viscosity, all these factors are important, pH, then the concentration, motility, morphology analysis, as I said before. This is how we see the sperm concentration as we so that we start counting sperms one by one. What we do is we have a microscope that have some squares on that, and what we count is the number of sperms in different of those markers. Markers are those squares, and then we do a media of how many of them are per square, and then we can calculate the average amount concentration per milliliter based on those. Sperm morphology is what I said before. So the normal sperm is the one that has this from here seen on the left side. It could be head defects, a sperm with two heads, too big head, too small head, too rounded, with no acrosomal thing. Acrosomeless, it means that the sperm doesn't have the cap in front of the sperm that's responsible for opening the egg fluid. So a sperm with no acrosome is not capable of fertilizing an egg and activating the egg itself. Male piece defect is that the male piece is the one in charge of making the tail move. It's like the engine of the tail. So if it's defected, then this sperm is not going to move properly. And tail defect means that the tail is not proper to swim. It's either too long, too twisted, or too short. A REM is REM is a test that we do just to concentrate the sperms, and then you see how after concentrating them, we can obtain better concentration or better motility or better sperm forms in that. This is pretty much a short resume of what the sperm analysis are, and these are the possible results of that. Aspermia or azoospermia is an absolute lack of semen, which means that the man just doesn't produce sperms, but it doesn't produce semen at all. It means that besides the idea of having an ejaculation and producing semen is not happening. Then astenospermia is the way we call when the sperms move less than desired. It means that we have less than 32% of the sperm moving progressively, or actually a motility under 40%. Azoospermia is having ejaculation, but no sperm cells inside that. It means an empty ejaculation, to say it away. Sporospermia is the way we call when the sperm volume, the semen, the ejaculation volume is smaller than 1.5 milliliters. Oligospermia means that the concentration is below our onset. Necrospermia is when we see that in the sample more than 60% of the sperms are dead. Teratospermia is what I said, if the form of the sperm is not successful or sufficient in more than 4% of the samples. And leukocytospermia is when we have too much leukocytes or so defense cells in the sperm, which could be an indication of an infection or inflammation in the whole seminal tablet. From these things that we have here, we need to understand that there's a couple of them that can be treated very easily. For example, oligosospermia, if that's not a critic, can be used with ICSI, as well as the astenosospermia is not so critic. Azoospermia is the major headache for us doctors in fertility, because if we have low sperm production, there are some things that can be treated. Perhaps if there's a dysregulation of hormones with treatment, we can get sperms to be produced. But if it's been a damage in the stem cell that's in charge of producing those sperms on the daily basis on the life, then there's not much we can do. Good. Then is this these are the different complementary analysis that we can do. As I said before, the common fertility is this fragmentation DNA test that we can do. Como sperm is similar to that. It's just another we that check just the single strand of DNA, and we always start to do common fertility because it will test both double and single strand. And semen or urine culture in case that we have infections, because that might be the cause for the low quality of the sperms. And then if it's all treatment with antibiotics and some anti-inflammatories may increase very much the sperm quality. That's what I said before. The common fertility allows to evaluate the percentage of fermented sperms in an ejaculate, and then for indicates what's the better technique that we can use to fertilize the eggs. As I said before, there's the possibility that just the simple strand fermentation is provided. It means that just one of the sides is broken, or double strand fermentation, which means that both sides of the strain is broken. As you know, DNA is a double chain that mixes together and is binded just for some structures in the middle. Then, if one of the chain is just broken, then it can be repaired easily. If both of parts of the chain are broken, then it's more complicated for the egg to deal and pull back the structure, and it's an indication for recurrent miscarriages, IVF, or poor embryo quality. Could be some of the things that could be caused by double strand fermentation. What can we do to increase sperm fertility? So there are multiple studies that say that a high intake of antioxidants like vitamin E, vitamin C, vitamin D, and CoQ10 could increase the quality of the sperms. If there's some undergoing pathology like inflammation of the prostata or varicocele, then surgery or reduction of the inflammation on the prostata. If it's chronic infection, antibiotics. And sometimes if it's the problem with the transfer of the sperms from the testicle to outside, for example, in terms of cystic fibrosis, or because the tubes were not created at all, then taking the sperms directly from the testicles to be used. If the problem is the DNA fragmentation, then we can use a fertile sheet. We're using a fresh sample, or we can use a Pixie, or its brand name, slow sperm, used to select those sperms if they are from a frozen sample that we have available. The other option to be to do tests in the sperms is a fish test that allows us to see how high is the percentage of sperms with normal chromosome number. Because if we find that it's a very increased number, then regardless the age, it might be an indication for PGTA testing of embryos later on, even in egg donation. The one thing that we use, and as I said before, Tambre has a sperm bank that we use to help our patients if they need it. And due to the law in Spain, we know that the Spain law requires that is perfect matching, physically speaking, from donors and intended receivers. For those purposes, in the clinic, we offer the PhenoMatch. This PhenoMatch is an artificial intelligence gadget that allows from pictures of the recipients, of the intended parties, and the donors to have a physical perfect match. So we are able to to select sperm donors better? Once we've led to diagnosis, then we can have a best approach and decide what is the best technique to help you in this treatment. That is first sperm sample, frozen sperm sample. We want to use sperm DNA for sperm DNA sperm fermentation technique, or if we need to perform a TSA, or if in some cases a sperm donor is needed. Thank you for your attention. I've said pretty much everything what I wanted to say. I tried to keep it short because for me the most important thing is to answer all of your questions. So I'll be very happy to answer all of the questions that you have for me now.
Brilliant as always. Thank you so much for this presentation, and of course, through all possible tests that you can do and what is important to remember. But as you can see, we are, let's face it, we are mostly here for the Q&A, of course, and as you can see, there are plenty of those. So that's a good sign. Glad that you have so many questions, and of course, remember that we have now around 30 minutes to answer those. So don't hesitate, and let's have a look. There are some of them are actually quite long, but let's have a look at the first one. So high pH in sperm, other than it may indicate infection, are there any other indicators that may cause raised levels?
Yes. It may also be a sign of low sugar concentration in sperms, which also reduces motility. It may also be a sign of a non-proper production of sperm, because if the pH is not adequate, it might be an issue also in the testicles producing sperm. So it's not just a sign of inflammation, is a very important feature in the sperm analysis.
Okay, I believe it was helpful. If there are any follow-ups, let us know, of course. So let me show you the next question because it's a bit of a longer question. So let me publish this for you here. So I have 3 rounds of IVF failure, 9 embryos transferred, 3 IUIs failed, only got implantation twice with that IVF that ended in early loss. 8 years trying and tracking every month. All my tests came back normal. I ovulate, tubes open. My husband had a sperm test and it was normal. His morphology was 3%. I was able to get pregnant once before I met my husband, ended in 5-week loss. I recently tried with another man and got pregnant and it ended another 5-week loss. How can my husband have a normal test and not be able to get me pregnant? Any advice here?
Well, I think these questions, I'm very sorry if I'm not right when I assess this. Uh, I don't think it's proper to claim for guilt any of parts of the couple. So I'm sorry what I'm going to say, but I don't think it's okay to say how come he can't get me pregnant. As at the end, we get pregnant as a couple. From what I see there, as you've heard before in the presentation, there are a lot of other assessments that we can and we should do. There could be a DNA fermentation test. We should see 2% motility is 2% morphology is also a feature that's not normal, it can be tested as well. We also will have to see age of patient at the moment you start to try it, because it's not the same thing starting to try with 25 years old, 30 years old, 35 years old, 38 something. That's a very different thing. It's also important to prove if the patient karyotype is normal, if the karyotype of those partners she had were also normal. And in this specific case, when we see that there's always been, also a couple of times have been implantation and it's not succeed to a successful pregnancy, I will also have to say that there are some other causes for repeated abortion, repeated implantation are also associated to women's fertility that should be checked in this patient.
All right, thank you so much. Again, Cassie, if there's anything you can add, of course, we have time, so don't hesitate to do that. And let's have a look at the next question that we have. So, is round cells the same as leukocytes?
Correct. So, embryologists define the thing different ways. We speak it always as doctors and biologists, sometimes very complicated, but it's exactly the same. Round cells are those cells that are not sperms, and those round cells are mostly leukocytes. It could be also erythrocytes and other cells, but mostly when you say round cells, we refer to leukocytes, which is a sign of infection or inflammation.
Okay, brilliant. Thank you for confirmation here. Anne would like to know, what are the methods used to count the shape of the spermatozoa and the percent of normal shape? What is the most reliable one? I have been told that my labs perform a visual analysis and count, so it's not very reliable.
Well, yes, there's not all the way to see the form of the sperms. The patient is right. It's a very subjective, well, rather subjective assessment of the sperms. But at the end, if you have a sample, you need somehow give some features about that. And if you have a sample that you put on the molecular dish and then you start counting them, you have to count a number of them. But at the end, we do it so it is statistically representative from the whole sample. So yes, it's observational. Yes, it's subjective in some way, but it's a very good way to assess that. The moment we don't have any other techniques like flow cytometry or all the things that will allow us to identify if the form of the sperm is normal. Count, maybe, motility, perhaps, but the form is something very complicated. We're nowadays working on artificial intelligence gadgets that will do an active assessment of the whole sample, but therefore it's always complicated because at the end, the sample we will use for that, we will lose because it will be treated by the gadget and it won't be able to be frozen later on. And sometimes what we do is we try to freeze a sample that we've assessed before, which we know in this sample what is the DNA fragmentation, so we can use it later. I told before the patients that there's a lot of variability in between sperm test ones on the other. Then, if we want to see how is the DNA fragmentation in a sample and therefore select the best technique to fertilize the eggs with that, having that frozen sample allow us to use the best technique for that specific moment because it may change for the other sperm sample that she might produce that he might produce for each.
Excellent. Again, thank you so much indeed for that. Let's have a look, okay? Next question is, what would you suggest if there is 60% of dead sperm cells? What could be the cause of this? And is it still possible to achieve pregnancy naturally? My partner is 39.
Chronic inflammation, chronic infection, autoimmune diseases. For these patients specifically, we might consider a TISA, which is aspiring the sperms directly from the testicles because they are the very immature form of sperms. We need to understand that the only real role of the sperm in fertility is provided DNA on the egg. That's why assessment through TISA of the sperm, extracting the sperm directly from the testicle in the very fresh and immature form, may allow us to avoid this type of situation, like taking them
Okay.
direct from the fabric.
Okay. Thank you. Brilliant. Again, thanks so much. Now we will have a look at some of the results. So let me show you here how problematic is 1% normal shape or spermatozoa. Here's the other parameters, volume 3.9, as you can see, pH, etc. So anything can affect.
In this specific case, and knowing that the only issue is the normal forms, this wouldn't exist something easy to treat because we have normal concentration, normal motility, progressive motility is outstanding. So in those terms, picking the 5, 10, 15 sperms that we might need to get fertilized an egg out of 22 millions uh, can work.
Sure, that's a good definitely here. Yeah, you can be a little bit more at ease, I think, in that case. Thank you so much indeed. So what is the purpose of medication like Clomid and HCG? HGC, I'm not sure here, for
It's
May
actually
infertility.
it's Miss Brighton. It's
Yeah, I think
HCG.
so. HCG,
So
right?
as I said
Okay.
before,
How
one of
well
the
does it work? Yeah, sorry.
yeah, sorry. As I said before, one of the reasons for sperm quality being lousy might be a disbalance in the hormonal axis. As women, men also have FSH, and this FSH should go from brain to the testicles and stimulate the Sertoli cells and the Leydig cells to produce sperms. If the FSH is down, then doing Clomid as a GnRH analog will go to the apophysis and promote the production of FSH. The same will go to the testicles to promote the sperm production and its quality. So that's the reason why we did Clomid, and ACG does exactly the same.
Okay, Again, crystal clear. Now we will go for a follow-up. However, it might be our final question. So if you have more, and it's been already, it's very interesting and straightforward, go ahead, type the questions in. And Anne would like to add, so it's the previous patient with the, she provided some details, yeah, about the volume, etc. So does 1%, let me show you, 1% of normal shape implies IVF ICSI. My doctor suggested to try normal IVF with ICSI despite a 1% normal shape and 98 anomalies of head. I'm skeptical about the success rates, but he says ICSI has high risk of miscarriage.
Okay, so first of all, I think there's not much things that are clear in fertility, but this is one of those. 1% normal forms is a clear indication to ICSI. That's something we all know. IVF might lead to fertilization failure, and at the end, the egg does not fertilize. It's a lost egg, and we normally don't have lots of those. So we will go directly for ICSI. And those studies claiming that ICSI increases the risk of miscarriage are to be taken very, very carefully into account. This refers mostly to ICSI as a technique to fertilization of eggs at a certain age which are not genetically tested. So at the end, with ICSI, we increase the number of eggs that may fertilize, may produce embryos, and at the end, if they're not genetically tested, then we might have gotten to promote an embryo that was not genetically healthy to go so far as to produce a blastocyst that can implantate. Therefore, ICSI after 35 years old is good, but always together with PGT-A testing of the embryos, depending of the ovarian reserve. So most of the patients say PGT-A testing of embryos after 40. Yes and no. Yes, with normal ovarian reserve. No, if low ovarian reserve. There is a strong association between low ovarian reserve and genetic abnormalities of X. So women with 35 years old, AMH under 1, low antral follicle count should be suggested if they go for ICSI without X to perform PGTA to avoid miscarriage of those embryos that otherwise wouldn't have succeeded to be fertilized. So I think at the end, we need to do in the laboratory the best assessment to produce the major number of embryos possible and therefore select those embryos already produced, not the other way around. Because at the end, if we fail to produce an embryo, that embryo might have been the genetically healthy one that could have produced the pregnancy, that could be the baby in the future. So selecting X from the beginning with IVF, claiming that with that, if it's just one, is the best one, is dangerous.
Right.
And leads to repeat more cycles, which at the end is not convenient for the women. So we have it very clear. We've checked it a lot. Things like mild stimulation, soft stimulation, just natural cycles are coming very, very criticized due to studies. And we're nowadays claiming that the best cycle is the most accurate one to produce the major number of eggs, and then we select embryos later on. Once we have them, we select them, but select them before they are is not has not brought us any further.
Okay. Again, I think it was quite clear. And if there's anything else, of course, you know what to do. And there's one more question from actually from the same patient. So yeah, a bit of a topic, but I still think we can answer, right? So can you please explain the karyotype and karyotype compatibility? If we both do our karyotypes, how can we interpret karyotype compatibility or incompatibility?
This is a misunderstanding. There's not such a thing as karyotype compatibility. A karyotype is either normal or normal. But they might be speaking about that it's genetical matching or genetical incompatibility, which refers to mutations carried genetically that we have, can pass by, but we don't suffer. So let's say in this way, let's go back to school very, very all the way. There was a very old priest called Mendel that did some research with peas, with white and yellow flowers. At the end, what all that came out after that is that genetics, there are factors that are dominant and there are factors that are recessive. In some of these factors, if you have a dominant mutation that produces a disease, you will always have it if you have one of those from your parents. But there might be recessive conditions that you carry in your genes but won't appear in your child until two persons with two recessive conditions mix together. When we do a karyotype matching or a genetic matching, what we do is to check in both of the parties if there are some mutations, recessive mutations, that if they are together and produce a baby, could bring into a deceased baby with a medical condition. That's what we're speaking about.
Okay, thank you for the clarification for this question. I think it's pretty clear right now. Someone is typing, so of course, let's give it a minute. I hope this is another question. I believe so. Yeah. So we need to wait. So yeah, let me just check if I yeah all the questions now we had answered. Yeah,
I
it's
have
right
one.
here.
Is
Yeah.
there anything that we can do to improve the shape of spermatozoa to have higher or normal shaped spermatozoa? There are some theories saying that sperms produced in the testicle that need to go through obstruction or chronic inflammation might be damaged in the process and end up in a sperm with a defect. So reducing inflammation, seeing if there's obstruction, seeing if there's varicocele, seeing if there's prostatitis might increase the normal forms as well.
Hmm. Okay. Again, thanks so much. And let's see. Yeah, I think it was crystal clear, as you can see. There's a thing. Yes, definitely. Go ahead. We are here for you. So of course, ask away. So it's always good. And if anyone else has some other questions, we still have time. Dr. Izquierdo is definitely on fire today and answered lots of questions already. So we can definitely take one more or more if you have some other ones, of course. But I think it was pretty yeah, interesting so far.
Thank you.
Yeah, lots of different questions too, but here, same question, but about DNA fragmentation. So if the percentage is high, is there anything we can do to reduce DNA fragmentation?
As I said before, one of the causes for DNA fragmentation might be just the unpacking of the DNA on the sperms, but other cause for DNA, high DNA fragmentation in sperms might be the oxidative stress, like too much stress, inflammation, infection. So once again, checking if there are infections, reducing oxidative stress, bad habits like smoking, too tight underwear, very hot baths, long bike rides can cause problems in this direction, prostate inflammation. So vitamins, eating healthy, loose underwear, not hot baths are all features that can increase the sperm quality.
Okay. Any supplements that you might also suggest?
Yes,
This is always a question
but
that,
no
yeah,
brand
comes
names.
up.
So vitamin C, 1,000 milligrams a day is the clinical indication. Vitamin E, 600 units is the clinical indication. CoQ10 or ubiquinone, 200 milligrams is the clinical indication. DHA or omega 3 or omega 6 are also indicated. Any of those supplements are very fine.
Okay. Thank you for adding that. I mean, I'm sure I mean, always, this is the question that is always asked, of course. And what if there is low sperm count after reversal vasectomy? What can help? Yeah,
So we
what
need
can
to
make it better?
understand the physiology of the sperm conduct. So once you cut the tubes that carry sperms from the testicles to the ejaculation, trying to build them again might work, but at the end that produces scar. And going through that scar might be very difficult for the sperm. So in those terms, I would really like to do a TISA, both as fertilization technique and as a treatment because as a diagnosis, because if we see that in the sperms we have better concentration, if we take them from the testicle, we will now know what's the issue. And as a matter
Mhm.
of fact, I'm not a huge fan for the reverse vasectomy for patients that perhaps are trying to get pregnant just if the woman is very young. So I'd say under 35 years old. Otherwise, I think TISA and IVF is always the better goal because it's
Mhm.
one thing done.
Okay. As you can see, more questions. So I've been told there is no need to do a DNA fragmentation test. Let's have to do ICSI due to very low sperm count and low motility. Do you agree?
No, we can have
Okay.
both low sperm count, low motility, and high DNA fragmentation. And there are techniques that allow to work with with a small amount of DNA of sperm concentration. So, for example, we have the sperm slow, which is a technique that allows us to do DNA fragmentation selection with very, very, very small amount of sperms. So
Mhm.
false.
Okay. Thank you for the clarification. I believe it was useful, and we definitely want to answer as many of those. And someone actually mentioned, I was familiar with these supplements for women. I was not aware they also work for men. So, yeah, remember, it's also
You see,
useful.
because fertility is a woman's issue.
Yeah, this is true. And that's why I'm very happy that we are discussing male fertility today as well, and options that are available. And it's a great session already. Someone is typing, so let's give it a minute. So with the DHEA, do you need a script for it?
I was say DHA.
Yeah, of course.
DHEA is what many women get to egg preserves, egg quality. DHA is omega-3, omega-6, so normal fish oil acids.
Exactly. So DHEA, no, not needed here when it comes to male
No,
fertility,
it's not
right?
for men. It's not
Exactly.
indicated, and it
Mhm.
does need prescriptions in many countries.
Yeah, exactly. So we want
Also,
to
good
clarify
thing
that.
Amazon, eBay can help us sometimes to get some things delivered.
It's true. I mean, we can find anything, anywhere nowadays. That's the truth. So, let's have a look. Like, could you type the supplements and doses of supplements for men in the chat box? Remember, it's being recorded as well. So I think that you can still rewatch this if Dr. Izquierdo can do that. Let's try. But remember, it's being recorded, so of course you will have a chance to rewatch it, and you can have a look afterwards as well. But I can see Dr. Izquierdo is writing this down, so you can make notes. I'm very happy to. Yeah, brilliant. Thank you so much. But DHEA can increase the number of follicles, right? DHEA.
Let's take it easy. There are now studies that confirm that DHEA may have an effect in the actual follicle count or in the number of eggs retrieved. There are some studies that claim that it might help in the maturation of the eggs while stimulating. But we need to understand that the ovarian reserve is an absolute number women are born with and can be affected with medical treatments afterwards. So we cannot enhance the production of new eggs. We might increase the answer of the ovaries to those. We might increase the way the eggs mature and if they are retrievable. But absolute numbers promising looks so far. Stem cell therapy, even the PRP therapy is very critic at the moment. We haven't had any positive results so far, so it's a bit of a trendy topic, and it's I think enough for a whole new presentation.
Mm.
Low arm reserve
Yeah.
is a very 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 hot topic. It's not a 5 minute question.
Yes, for sure. We did webinars on that, obviously, and yeah, it's always a great discussion as well. If you can clarify CoQ10 200, what is this? If you can
Uh,
clarify CoQ10.
well, nice question. But CoQ10 is probably one of the most used vitamins in fertility. It's a supplement, yeah. Increases antioxidation, increases activity, metabolically speaking. It is good for blood sugar issues, overweight, metabolic activity, and enhance also the quality of eggs and sperms, both of them. CoQ10 is
Mm.
also called ubiquinol. I'm going to write it down here in the
Mhm.
chat. Seems to be very
Yes.
popular, the chat, by the way.
Yeah. Thank you
So
so much.
that's the
Definitely.
medical name of it. But it's very known
Definitely.
as CoQ10. If you put CoQ10 in everywhere, it's going to pop up right away. And directly after that,
True.
fertility, egg quality, IVF failed. It comes right away. The whole Google thing.
It's it's definitely one of those things that yeah, it's always mentioned most of the time during our webinars. That's the truth. Thank you so much indeed. And someone is typing. So again, I want to make sure that we've answered all of your questions. But it is a great session today for sure, Dr. Izquierdo.
Absolutely.
Lovely to have you back. You are always straightforward. Always love how you explain everything. You make it sound so easy, for sure. And as you can see, there are some thank yous. Thanks a lot for answering my questions.
Thank you
So
all for
before we
being here.
finish, anything else you wish to add?
Nothing. For all those people that were a little bit shy and didn't want to write the questions in the chat, remember this, my IVF answer always available, many ways to contact them. as well. Clínica Tambre, we have our contact folders on the web. You can look us in Instagram and all the social networking. So if you don't feel that this was the place to make your question, but you want to make the questions in another way, please. The only bad question is the one we don't ask, because at the end, when you have an answer, you are elated. So please contact us. There's a lot of people by my IVF answers, by European Fertility Society, about Tambre, ready and eager to help you.
I couldn't agree more. We are all here for you with anything that's come up. Of course, one more thing, if you can have a look, is Simon recommended? Anything on that?
Yes, by the clear indication. This
Good.
is been very, very new nowadays. The same things that it was a phase when everybody wanted to do intralipids, organocyte without clear indication. There's nowadays clinics saying, well, since we don't know, why not to use fertile ship, Simon, max? No, 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 no. It doesn't go that way. If it's an indication because of the DNA fragmentation, so then great. If not, it just reduces the number of sperms available, the number of the motility, the number of normal forms, and it makes the work of the embryologist harder with no extra reasons. So, if no sperm issues are found that the DNA fragmentation is being tested and there's no indication for that,
And if there's no sperm issues, this is the follow-up.
that's actually one of the last articles I read comparing Simon with no indication and Simon no, comparing sperm outcome, sperm normal with and without Simon, no differences at all in
Okay,
any of the
crystal clear.
outcomes.
Yeah.
Either pregnancy rate, either live birth rate, miscarriage rate, none at all. So it doesn't help at all if there's no issue. And it's
Yeah.
expensive.
Of course, definitely. So thank you for the clarification here. I believe it was again useful for you. I think that we might have another question because someone, yeah, there it is. So when a percent of DNA fragmentation is considered high, what value?
No cooking recipes depends on the test you perform, what technique you're using. If you're doing a flow cytometry test, it's about around 16%. But if you're doing another techniques, like for example the comment, we're going to 60 or 40%, depending if you're doing ICSI or normal IVF. So there's no cooking recipe. It depends a lot on the test you're doing.
Okay. Again, brilliant. Thank you so much, Anne, for your
My pleasure.
another question here. And yeah, and as Dr. Izquierdo already mentioned, if there are any other topics you can, or questions, sorry, you can definitely get in touch with us. We'll be more than happy to help you out. And I'm sure Dr. Izquierdo and his team at Clínica Tambre, they are offering all kinds of consultations as well. So feel free to reach out. And before we finish, I also want to encourage everyone to take part in our survey. You will be redirected to our survey right after this webinar. So I can only encourage you to go ahead and do it. It will take 1 minute, 30 seconds, so it doesn't take too long, but just share your opinion about this webinar, but also other webinars, what kind of topics you wish for us to discuss as well. And anything like this is always helpful. We want to grow, educate, and do it, we want to help as much as possible, of course. Thank you so much, everyone. Have a lovely evening. But before we finish, one more thing. We will be back actually tomorrow. There will be another webinar. We will talk about egg donation in Spain. So if this is a topic you are interested in, I can only encourage you to sign up. It's already available on our website. So go ahead, or our social media, Instagram or Facebook. You will find the registration link there. So I can only ask you to go ahead and do it today. And I hope to see you here tomorrow. Dr. Izquierdo, looking forward to some more events shortly. Have a lovely evening as well. It was great to have you, and take care. Speak soon.
Thank you.
Bye.
Thank you a lot. Bye bye.